we've sort of mentioned that it's the early detection of AF that is probably the biggest challenge that we have to address if we want to make a meaningful impact. So give us some strategies as to how we can improve that early detection and awareness for our patients.
Just before I do, in relation, just to quickly address some of the poll and this holistic view that we were just talking about, I think the audience are quite right. The thromboembolic risk is obviously a major issue, and again, that's the origin of that is back at the atria and the stasis that creates the clot formation. But I think it's really important to also identify that this disruption in hemodynamics doesn't just sit in the chambers of the heart, and that, as you quite rightly said, gets transmitted right the way into the ascending aorta, into the carotid, and up right the way through and transmitted to the brain. And it's that insult or hemodynamic instability and turbulence in flow that we can see that gets all the way to the brain. And one of the slides I have here is you can do a transcranial Doppler that allows you to see that the bottom left of your screen will see that this is the flow profile going into the brain. So again, this is highlighting that the hemodynamic changes associated with the atrial fibrillation originating back at the heart is actually transmitted right the way through to the brain. And it is really important because it determines the type of blood flow that gets to the brain, but it also back downstream in the carotid. If there's already a clot that has formed and adhered to the edge of the arterial wall, this turbulent flow has got a greater chance of dislodging this clot, and then that gets transmitted to the brain. And this is where I think hypertension also has a role to play in being the driving force, the mechanical energy that then combined with it will really drive on and increase this risk of clot disruption from the arterial wall and being transmitted to the brain. But in terms of hypertension itself and AF, in terms of the risk of stroke, we know that there's a lot of similar risk factors that are associated with it. Obesity, we know smoking, sleep apnea, but also endothelial dysfunction. When you have a turbulent hemodynamics that leave the heart and go towards the brain, you also affect the endothelial function of the arteries that this blood clot or blood pressure and flow gets transmitted through. Now, if you combine those risk factors with hypertension, then that exacerbates the risk of having your stroke. But combine it with atrial fibrillation, you have a double and a deadly combination of thromboembolic risk originating from the heart, from the atrial fibrillation, combined with a high pressure that will then increase your risk of developing and transmitting this highly problematic clot to lodge in the brain and therefore create the risk of the stroke. So I think the combination of hypertension and atrial fibrillation is very important to consider, and I know it's been proposed in many studies where hypertension itself is a precursor for development of new onset AF. So it's important to try and keep that in mind. You mentioned then in your question what can be done on maybe a more community-based global level to try and address this risk and to try and increase awareness. Well, we, as part of the May Measurement Month Blood Pressure Awareness Campaign, have been trying to address the blood pressure inequalities, the understanding of undiagnosed high blood pressure in the community. This year now we're pairing up with AF Screen Global Campaign to try and combine, when we're doing some blood pressure measurements, to do an AF detection at the same time, highlighting previously that the interconnection between hypertension and AF is such a critical measure, and both together increase your risk of stroke. It's a perfect match to try and increase community-based detection. Previous years, what we've been doing, we've been trying, like you've suggested previously, we've been opportunistic screening of our early detection awareness campaigns that we've been doing have to try and reach out into the community to get more awareness, more detection of those walking around with high blood pressure. And as I said, this year now we're going to be moving into and combining this with AF Screen to try and prevent AF-related strokes and improved detection of AF in these communities. We've done a lot of promotion of this campaign through the Lancet, European Heart Journal, and we've tried to use these campaigns and using celebrity endorsements to try and increase this awareness even further. As Professor Osman has quite eloquently alluded to, these various different devices that are now on the market that will allow us to improve early detection. And again, it's critical that we're using devices that are being well accepted, they're valid, and they give us accurate readings. And again, with the complete device here at the bottom of our screen, we are going to be using some blood pressure measurements and AF detection at the same time, because the complete device has the AliveCore, the system inbuilt into it, which allows us to be able to measure blood pressure and AF in every participant that comes through. So this is where May Measurement Month and the AF screen will come together, and using technology, we'll be able to get this out into the wider public. Of course, we'll be adhering to the guidelines, and this early detection identification process, together with the May Measurement Month protocol, will be informing participants about the significance of implications of AF. So again, a lot of awareness in this perspective. We'll also be informing them of a structured referral platform, which has been advised and devised with clinicians, that once detected with the systems, that is considered possible AF until the arrhythmia specialist or the GP has actually seen the rhythm, like Prof. Osman has previously suggested. So this is not a diagnosis, but a possible detection of AF for future consultation. And there's a lot of resources that we've provided from AF Association, Arrhythmia Alliance, Knowing Your Pulse, and videos to how to go about doing this and understanding what your pulse means when you can palpate it, in addition to all our blood pressure awareness details and guidelines that we have for May Measurement Month. And at the end here, I guess I've got some resources here that people can click on and use for both the May Measurement Month campaign and the Arrhythmia Alliance AF screening collaboration that we'll be undertaking.